Okay, so day 5 of the challenge of making a video every day on this page. Today I have a question from James, and James tells me, I've met a lady that has an older dog that her husband took for long walks. Even after long walks, the dog would urinate a few drops at a time. The dog got an infection, which turned into a bladder infection. The vet verified the bladder infection and gave antibiotics for 3 weeks. After that, there was no more signs in the urine test, and the vet says it was all gone. End of treatment. The dog is now incontinent and still licking as he was with the bladder infection. Can you comment on your experience on how you would deal with this? I told her that there are points and I would ask for direction. Thank you. Okay, well, with just this information, this is not enough. Meaning, I would have to know what has been going on. Has this animal been castrated or sterilized? When did that happen? How old is the dog? It's all the little elements to know. Do we have to do with an incontinence that's following up the castration operation? Or do we have an incontinence still due to a urinary infection that the vet hasn't seen? What could be the reason? So that is to go and deal with the origin of the problem. Meanwhile, for this dog, you can start with phonic therapy, doing the standard points every 2 days and the specific points for urinary problems. You will see in the booklet we have specific points for incontinence, so you can use those. But for us, as a therapist, it's always better to know the history, okay, to know what has been happening before. It's not just the long walks that suddenly have given any infection. It didn't start that way, okay? So let's find out what the origin is of the problem. But meanwhile, towards standard points and towards the points for urinary problems and incontinence. Okay? Bye-bye.